Cancer sucks. It just sucks. It just sucks worse when it's your father or your friend or, you know, someday you. And with this particular form of cancer, there is a lot of hope and a lot of things on the horizon, and it's really exciting. But it needs support, like, you know, like anything.
I was diagnosed 4.5 years ago. Every once in a while, it comes back and haunts me. Probably like every other day.
When it's your dad's life or when it's somebody close to you, the last thing you need is any kind of holdup.
A funding organization will put out a request for proposals. There could be 100 grants submitted, could be 1,000 grants submitted. They're then critically evaluated and ranked, and the ones with the best science will get funded. It's a very, very competitive game. Competition is good, competition is healthy, but at the same time, it can be divisive.
What MMRF has done such a good job of pushing is the idea that as soon as you get a piece of information, you should be sharing that. It's the difference between a cycle time that might be a year and a cycle time that might be weeks. We get so many more turns of the cycle, and progress goes so much faster if people share.
At the MMRF, we saw a cancer research system that was broken. We understand that academic centers have to publish in order to keep their businesses going. We understand that pharmaceutical companies have shareholders they need to report to. But at the end of the day, what we did as a trusted third party was we brought academic centers, pharmaceutical companies, patients all together and said, what can unite us?
When I joined the MMRF in 2002, there had been no treatments approved for more than 30 years. Patients were living just 3 to 5 years from diagnosis. Since then, we have played a critical role in approving 6 new treatments for multiple myeloma that have led to the doubling of patient lives.
No other cancer research organization has a better track record of success. They're my strength, my foundation, my support.
I think the most important thing the MMRF is doing as we move forward is building the largest, most robust, integrated data set in cancer.
It is a very valuable resource for drug development scientists, clinicians, and patients, frankly, as they understand what type of myeloma disease do I have, because it's not one thing. So which one am I most like?
Part of the work that we're doing is to dissect the genetic information from a patient with myeloma. We want to capture every letter of the 3 billion letter alphabet that's in the cancer genome and be able to put that information in a readily available, understandable fashion for physicians to use. We're fortunate to have a clinical program on top of a research program, and it really directs us, it leads us. It's one of the reasons why MMRF has been so successful, is to align the clinical questions first and bring underneath them the tools and technologies to really make a difference for our patients.
We will start to be able to sequence treatments for patients, get to longer remissions, and eventually a cure.
If we started out with the intention to cure all cancer and eradicate it from the face of the earth, we'd fail immediately. It would be like trying to consume the elephant in one bite. It's not possible, right? But if we figure out a way to overcome the fundamental challenges that face us in this particular disease, and myeloma specifically, there's nothing that's going to prevent us from being able to translate that to other cancer types, because this is the most diverse.
All these cancers are miswiring cells in very similar ways, and discoveries from skin cancer, particular genes mutated there, are turning up in multiple myeloma. It means we can move faster because we can draw on knowledge from one cancer to accelerate knowledge in another cancer. It's about one problem, cancer.
There are many kinds of cancer that can already be cured. There's still a long ways to go for others, but it's now estimated that 1 in 20 Americans are walking around and they're cancer survivors. That's why those of us who are working in the area have more than just hope that you can make big impact if we hurry and keep the intensity.
The same way MMRF has brought together the multiple myeloma community, we now need to bring together the whole cancer community.
There is not a better time than right now. And if we can get everybody on our side, we will find cures so much faster. We drive toward results. We have never let anyone down, and we will continue to be a winning team, never taking our foot off the pedal as we accelerate cures.
No one has fueled more studies, initiated more trials, developed more treatments, or introduced more medicines. They've had a far greater impact than any other organization. They are curing cancer now.
Without a doubt, MMRF is going to have played a huge role in the defeat of this, without a doubt.